Once someone decides to do Sculptra, the next question is, how much Sculptra do I need? When am I going to see results? How long does it take? So I'm going to help you determine how many treatments of Sculptra you're going to need, along with
how Sculptra treatments are spaced out, and how often you should get Sculptra to maintain your results. This is an actual patient. Guess how many treatments she had to get results?
Stay tuned to the end to find out.
So how many treatments of Sculptra will you need? We lose around 1% of collagen each year. So this means if you're 45 years old, you've lost around 25% of collagen. Sculptra is measured in vials as opposed to filler, which is measured by syringe. So how do we determine how many vials of Sculptra you'll need? A general helpful rule of thumb to help you determine how many vials you'll need is the rule of decades.
Generally speaking,
the total number of Sculptra vials required to give meaningful results is usually equal to the number of decades you are. For example, if you're 32, you may require 3 vials. If you're 40, you may require 4 vials. If you're 62, you may need 6 vials to achieve meaningful results. But these vials are not done all in one treatment session.
The vials are not always done all at once in one treatment session, especially if we think that you're going to need more than 2 vials. It's usually done over the course of a time period, if we're talking about the face.
So let's say you're 35 years old. What I usually do is start by treating you with 1 vial in one session, sometimes 2 vials each session, depending on how much volume loss you have, but no more than 2 vials per treatment session, and then see you back in 3 months, giving enough time for the 2 vials of Sculptra to take effect. At your visit, we would then compare your before and after photos and then assess whether or not you need 1 or 2 more vials. Remember, you're 35, so you may need a 4th vial because you're in between those decades. So this means that you would have had 3 or 4 vials over the course of 6 months.
This is why I call it the Sculptra journey, because your results are not apparent right away. It takes time. You didn't age overnight, so you're not going to regain all of the lost collagen throughout the decades overnight. The amount of vials you need is also dependent on your individual volume loss.
Let's say you're 35 years old, but you have a lot of volume loss because you work out a lot. You're a runner or do Pilates, or you're very lean and have low body fat.
You may need 4 vials before you see the result you want in order to get the look you want, to really soften your look and get rid of all visible hollowness.
Now, sometimes I have people and they're seeing hollowness, but they kind of like it. Some people like a good amount of definition in their face and they describe it as the heroin chic look. So let's say you're in your mid to late 30s, but you like the heroin chic look. But now you begin to notice that now you're becoming too gaunt looking. You get to the point where it becomes too harsh, and now you want to tone down some of that definition, but not completely get rid of it because you like some definition.
Then we may only need 2 vials in order to soften your look, but still leave you with some definition.
When will I see results?
Generally, it takes a full solid 3 months in order for your collagen to be restored. Now, sometimes I have patients who notice results sooner than 3 months, but we're still going to give it the full solid 3 months for all your collagen to be restored.
Do I have to come back in for a follow-up after getting treated?
Yes. I always have patients come back in person so we can look at their before and after photos, so we can see how you respond, and then we can get a better sense of how many more vials you'll need. It's really important that you come back in for your follow-up because the onset of results from Sculptra are so gradual as opposed to filler, which is instant. And sometimes people can't tell if they see results until we look at their before and after photos. If we don't see any changes, which rarely happens, chances are it's because you need 1 or sometimes 2 more vials. I've never seen Sculptra not work. So if we don't see anything, chances are it's because you need more treatments. Now, here's an instance where I may change the timing of your follow-up and not wait the full 3 months for your results.
Let's say you're in your 60s and you've never done anything, as in this patient. We would plan on doing around 6 vials, but not all at once over the course of time.
So if it's estimated that you need more than 2 vials, as in the case of this patient who never had anything done before, I'll have you come back in 6 weeks instead of waiting the full 3 months. In this case, I'm not giving Sculptra the full amount of time to see full results because I know know we're likely to need more than 2 vials.
So at 6 weeks, when we compared her before and after photos, she had very noticeable results, and we were very happy. And she's since done 2 more vials, which equals a total of 4.
Now that she's had the 4 vials, I'll wait the full 3 months or 12 weeks for the full results before deciding to do more. And then when she comes back in for follow-up, we'll plan on whether or not she does 1 or 2 more vials from there.
Which would total 5 or 6 vials, which is close to the rule of decades. So with Sculptra, the idea is to treat, wait, and assess. What kind of results will I get?
Results definitely vary from individual to individual, but what I find is the people who have the thinner skin tissue, who are a little bit more sunken,
what I call sinkers from the facial category sinkers versus saggers,
they usually end up seeing results that are more apparent than someone who has thicker, denser tissue.
What I find is that if areas of your face are gaunt, like for instance your lower cheeks, it's easy to appreciate the restoration of volume to this area because it's concave. So when the volume's restored to these hollow areas, it's usually more apparent. This gentleman had a localized area of hollowing, and you can see after 2 vials, he had great results. And after the 3rd vial, this area filled out even more. As mentioned in another video, if you are of sub-Saharan African or East Asian ancestry, you may see results more quickly, and the theory behind this is because of the differences in the fibroblasts. Can I expect to see results after 1 treatment?
This all depends on how much collagen you've lost and the rule of decades according to your age. If you're younger, you may see results after only 1 vial or 1 treatment.
It also is dependent on how you, as an individual, will respond. Everyone's skin and fibroblasts, the cells that make collagen, work differently, which is why some people keloid and form hypertrophic scars and others don't. This patient is in her mid-20s. She's a model, so maintaining her beauty is of the utmost importance. She was just starting to notice the subtle changes of volume loss to her temples and submalar or lower cheeks, so we did 1 vial and bam, she had a fantastic response. So 1 vial, that's the answer to the question. It took her only 1 vial, and that's likely because she was younger, so she hadn't lost as much collagen.
But most people, the signs of facial aging go unnoticed, probably because they get caught up with other things in life, they're not as educated about the signs of facial aging, so they tend to start Sculptra at a later age, and by that time, they need multiple vials. It's very rare that I do only 1 vial and I get this type of result because most people are coming in later in life. Once you get to a happy place with the amount of volume you've restored from Sculptra, then you can maintain your results.
How often will I need to get Sculptra treatments in order to maintain results? Are additional treatments needed?
Absolutely, because we don't stop aging. We continue to lose collagen, not to mention bone loss, and we lose our fat pads. If you work out a lot, you may want to do 1, possibly 2 vials a year for maintenance.
Especially if you do a lot of cardio, you're very lean, or you don't have a lot of body fat, you may want to get treated every 6 to 9 months, which is what I do. And it's not that my Sculptra would be gone at that time. As mentioned in other videos, I've never started back at baseline with Sculptra. That would probably take years without Sculptra before I go back to baseline. It's just that I really love that soft glow that Sculptra gives me, and I know that the cardio exercise kind of works against it. So that's why I like to get treated around every 6 to 9 months. If you smoke or get a lot of sun exposure, these things break down collagen, so you may need to get treated more frequently depending on how much smoking or excessive sun exposure you get for your skin type. How is Sculptra priced?
Sculptra is usually priced per vial. Now, in the cases where you need a large number of vials per session, if someone's trying to build up loss of collagen or gain a little volume in their butt, yes, you can actually use Sculptra in the butt. I have a video coming out about that soon. So since the butt is a large surface area, a lot of times we may reduce the price per vial because a larger number of vials are usually needed. If you have more questions on Sculptra, like how long does Sculptra last, I did an entire video on that topic and you can watch it here. And if you have more questions, you can check out the Sculptra playlist on this channel.